Now, there are two concepts that are different and are osmolarity and osmolality. For us, one good thing that has clinical practice, we don't care about the difference between osmolarity and osmolality. In fact, we say osmolarity, osmolality, and we don't even think on what we are saying because for us it's practically the same. Notice that they are different. Okay, osmolarity measures the concentration of solutes based on the volume of the solution, for example, per liter. Okay, while osmolality measures the concentration of solutes, but based on the mass. Okay, the mass of any object is constant. Okay, depends on the amount of atoms that we have. Now the volume may vary depending on the temperature. Okay, but in us, temperature is not going to produce those variations in volume because our temperature doesn't vary that much. If we were working in the chemical industry making different compounds, different products, for the agriculture maybe, we would care about osmolarity or osmolality because those compounds or those chemicals undergo temperature changes that sometimes are very important. Okay, so they care about osmolality, osmolarity, we don't. Okay, we use the same word as if they are synonyms. Now, if you want to be correct, okay, maybe you want to use osmolarity for medications and preparing IV solutions and osmolality for when you're talking about the body fluids. It's more accurate. Okay, we typically measure the osmolality in body fluids, plasma, urine, serum, okay, to assess the patient, but it doesn't matter and no one will care if you say one or the other. Okay? Now, what is even more important than osmolarity or osmolality is the concept of tonicity. Remember that osmolarity, or the differences in osmolarity, are the ones who are going to determine the movement of water. Water will follow the osmotic pressure, will go to the place of greatest osmolarity. Now, not all the osmoles, not all the solutes that create the osmotic pressure or osmolarity are created equal. There are some of these solutes that contribute more to the osmolarity than others, okay? Because everything will depend on the permeability of the membranes to that solute specifically. And when talking about human physiology, okay, there are basically three things that determine the osmolarity of the blood or the serum or the plasma. Those are sodium, glucose, and urea. Now, when you look at the formula of how you calculate osmolarity, okay, you have in the previous slide in the notes, osmolarity is calculated by using the sodium level times 2, so twice the sodium, plus glucose divided by 18, plus urea, or the BUN, divided by 2.8. If you take the normal values of sodium, 140, and you say glucose is, let's say, 90, and you take a value of urea, maybe 12, you will obtain, when you divide or you times to the sodium, okay, you're going to get 280. But when you divide 90 by 18, you're going to get like 5. And when you divide the urea by 2.8, you get another 5. You're going to see that the greatest contributor to the body osmolarity is sodium. Okay, glucose and urea almost don't participate, at least significantly, in the body and the fluids osmolarity. So when we are working with patients and we obtain the sodium levels, we typically say sodium is 140 times 2, 280. So we say this patient has an osmolarity of 290, which is normal. Okay, the body osmolarity, the normal, depends on the lab, but typically is between 280 and 300. Some labs tell you 275, 295, but between those values. Okay, so sodium is the most important determinant in the healthy person. Because what happens in cases of some diseases? Imagine a person who has diabetes. Okay, I told you when you calculate osmolarity with normal values, you obtain like 290. But imagine someone who has diabetes type 2. They come to the hospital feeling confused. They don't even remember who they are or where they are, what day is today. And you find that they have the blood sugar levels in 500. So now is sodium times 2. 280 plus 500 divided by 18. Now glucose is an important contributor to the osmolarity, because in the case of people with diabetes, the problem is that glucose can't enter the cells. Either because they don't have insulin, they don't make insulin, or because their receptors for insulin don't respond to insulin. In any case, glucose stays in the blood, doesn't penetrate the cells. This is important to remember because that explains very well what is the concept of tonicity versus osmolarity. Okay, tonicity is given by the presence of what we call effective osmoles. Another name for tonicity is effective osmolarity. Remember, osmolarity is determined by all the solutes that are present in the solution. Tonicity is only determined by the concentration of solutes that don't or can't penetrate the cells. Okay, most typical in physiologically speaking is sodium, but in some diseases, glucose may be also an effective osmole because it doesn't enter the cells. Or if we drink ethylene glycol, antifreeze, or if we drink methanol, okay, we drink any of these poisonous alcohols, the osmolarity of the blood is going to increase as well. Now, what happens and why it's important to understand the difference between tonicity and osmolarity? Because when you have a substance that doesn't penetrate the cells and increases the osmolarity of one compartment, water will follow that osmolarity. And in the case of glucose, if we have the blood sugar levels in 500, your cells are going to dehydrate. They are going to shrink. And if that happens to my skin cells, I don't care. If that happens to my stomach cells, but if that happens to my neurons, they will stop talking to each other. And that's why these guys don't remember what day is today, who they are, and have this confusion. So the important thing about this tonicity, that is a qualitative measure, okay, of the solution to cause a cell to gain or lose water, is to understand that when cells are placed in isotonic solutions, nothing is going to happen. They are going to remain with the same size. When they are placed or surrounded, because we're not placing them, you can place them in an experiment, but when they are surrounded by a hypertonic extracellular compartment, they are going to shrink. Water moves out of the cells. And when they are surrounded by a hypotonic extracellular fluid, okay, in that case, water will enter the cells, causing them to swell and burst. There you have examples of isotonic solutions, normal saline, 0.9 sodium chloride, hypertonic, or 3% sodium chloride, and hypotonic solutions can be pure water or half normal saline, which is 0.45% sodium chloride. Okay, medically speaking or clinically speaking, when we say pure water, we are referring to dextrose 5%. And you put dextrose 5%, is like water. That has no osmolarity at all. It's like nothing. And we are going to stop here. Okay?